We are observing the LTV 1150 in the volume control SIMV mode. Please note that if your child is set for mandatory breaths, as you can see here, we have 12 breaths a minute set on this machine, and the tidal volume, or the size of the breath the machine will deliver 12 times a minute, is 300 cc's. The advantage to having a set amount of volume delivered into the child's lungs is that the machine also records the peak inspiratory pressure, or PIP, as you see now on the screen, reading 21 or 22. If the child were to cough and have difficulty receiving the air, the machine will then, when it tries to blow in the 300 cc's of air, alarm high pressure, based on where we have the high pressure alarm set. So just to review, when the machine is set in a volume targeted or volume controlled breath, here you see 12 breaths a minute set at 300 cc's. Where does that 300 come from? It comes from your doctors and their decision to set that number based on your child's weight and size. So for this particular child, 300 cc's is the appropriate amount for the mandatory 12 breaths that the child is going to receive. And if they build up secretions in their lungs or have a blockage of the tracheostomy tube, the pressure that it takes to get the air into the lungs will rise. And it may rise a little bit, it may rise a lot, in which you violate and see and hear the high pressure alarm. It's important to note that. It's a very useful mode for children that are school age and coming and going on the bus and to school and to different classrooms. It alerts the caregiver very quickly if there's a problem with the tracheostomy tube and air entry into the lungs, because that 300 cc's is not going to go in easily and it will violate the high pressure alarm that's set. For obvious reasons, the alarms have to be set properly. In this case, we have the high pressure at 40. It depends on your child's normal activity level and settings. You would want the high pressure alarm to be set no more than 10 centimeters above the pressure that you normally see them exhibiting on their PIP screen on their ventilator. As you remember, this one was showing us 21 or 22, so we would normally set the alarm at 32 or so.